Now I'm just going to finish off because you are all running in panic about the last minute preparations. So just a few more instruments which you need to know about, which you, as a student you should be aware of. For example, you know this is a rice tube, and the rice tube is mainly used for feeding purpose as well as for aspiration, nasogastric decompression. It is identified by the presence of three pellets, lead pellets on the tip. So that is for identification by X-rays. And you may be asked about what are the other uses. It can be used for a feeding jejunostomy, and it can be also, you will be asked, how will you put a rice tube, how will you know its position in the stomach. All those things you should be aware of. Now the second is IV cannula. And IV cannulas, you need to identify the gauge by the color code. And if I'm the examiner, I'm sure that I'll be asking this because it's a basic thing which all medical graduates should know. And there are the number increases, the size decreases in cannulas. The commonly used cannulas are number 16, 18, 20, and 22. And in adult, we either use number 18 gauge cannula, or if you want to transfuse a rapid amount of fluid, especially in a patient with a shock, you use number 16 or ash cannula. So you should know the color coding of cannulas, and as you know, the number increases, the diameter decreases in IV cannula. Now comes to the next instrument, that is a Malachor catheter, and it is a self-retaining catheter. You can see that there is prongs on the side, and that will hold. It makes itself retaining, and it is used for SPC, that is the suprapubic cystostomy. Can be used for drainage of abscesses, and it is self-retaining, so it will stay back in that site. That is advantage, and that is a Malachor catheter, and it is also used for a gastrostomy. Now, this is a sense-taken Blackmore tube, and it has got a gastric balloon and an esophageal balloon. And when you inflate, the advantage is it will cause tamponade of gastric as well as esophageal varices. And this is used for a primary resuscitatory measures in esophageal bleed. It cannot be kept in place for more than 8 hours because it will induce necrosis. You will be asked what is the capacity of the gastric balloon, that is 200 to 300 ml, and the esophageal balloon is in place to 40 to 45 millimeters of mercury to produce tamponade effect. You can't keep it more than 12 hours. Now, Folly's catheter can be 2 lumen or 3 lumen, and you all I have used or seen Folly's catheter, but you should know as the number of the Folly's catheter increases, the diameter of the tip or the size increases. So, for a child you use number 12, for a female number 14, and for a male adult, either you use adult male, you use number 16 or number 18 catheters, and it has got a bulb which is inflated to around 30 to 50 ml, up to 30 ml, even 10 ml will suffice. And when there is a trilumen catheter, that is used for whenever you have use a TURB procedures for irrigation of the bladder. Right. Now, what is this? This is an endotracheal tube. Every medical student should identify. I don't want to go anything into detail, and the uses are, you know, that it is used for giving GA. This is a naropharyngeal tube, or called as a Gordell's tube. This is a nasopharyngeal tube or nasotracheal tube. Nasotracheal tube we use for nasotracheal intubation or nasotracheal airway, especially when you have got a bad facial-maxillary injuries. To get an initial airway access, you can, in a suspected cervical spine injury, you can use this tube. This is the tracheostomy tube. Similar looking one is the tracheostomy tube also. Both looks almost identical, and these are self-retaining. And this is laryngeal mask airway, which is used for daycare surgeries and for giving GA for short GAs. This bulb actually sits on the laryngeal inlet. It doesn't go into the laryngeal inlet and cup it so that aspiration is prevented. And this is a T-tube, and we all might have seen this, and we have discussed it in detail. T-tube is used when you are removing the stones from the bile duct, choledocholithotomy, and then you keep a T-tube in the bile duct, and it is taken out. And it is normally kept for 7 to 10 days. On day 7, you perform a T-tube cholangiogram, and if there are no obstruction lower down, you can take it by pulling it out by around day 10. These are suction drains used for surgeries which are superficial, especially the breast, thyroid, superficial surgeries like hernias, varicose veins, or any surgeries where there is dissections in the superficial tissue. Very rarely used in cavitary surgeries. This is a double lumen endotracheal tube, and the advantage of this tube is it can be used to give single lung anesthesia. And single lung anesthesia is important because that it can be used whenever you want to do an esophageal surgery, especially on the right side. You want to collapse the right side but continue the ventilation. You can use this double lumen endotracheal tube. Right. Now, these are esophageal intubatory stents and rubber tubes. On the right side, these are esophageal stents, and on the left side, we have got the Sauter's tube and the Atkinson tube, which were previously used. And on the right side, there are the self-retaining or self-expandable metallic stent. This is a Fogarty's catheter used for embolectomy, and this catheter's name is called as Fogarty's. Usually number 4 is used. It is used for taking the embolus out when there is an acute embolic occlusion, and these catheters pass beyond the embolus after an arteriotomy, and the embolus is pulled out. This is a central venous catheter. It's a type of central venous catheter which is used for central venous pressure monitoring as well as central venous blood inflow. This is a double J stent used for ureteric surgeries, which can be self-retaining and can be pulled out once the initial. You can see there is a double J stent. You've got an upper as well as a lower J, which is self-retaining, and you can take it out once the initial uses are over. Now, coming to certain stapling devices which is used in surgery very commonly nowadays, and you should be aware of. You might have seen it also in your different units you are posted in. This is a linear cutter which is used for gastrojejunostomy or jejunal anastomosis, and this will cut and staple, and these are used for gastric anastomosis. These are circular staplers which are again used for esophageal surgeries and low anterior resections of the rectum, where it has got a body. It has got a body as well as it has got an anvil, and this anvil is kept in the proximal intestine bowel, and the body comes out from the distal end, and the stapling is done. Right. So that is a circular stapler. This is a stapler that is used for dividing the lower rectum, or it is also used to divide the duodenum. It is called as a TA stapler, and this is again hemostatic, as well as it will staple up the retaining part of the bowel. This is a handle Doppler used for recording the pulse, the BP, the angle brachial pressure index, and it's a very useful hand accompaniment for any person posted in surgery. Right. Now, coming to the next one, this is a PEG. PEG means percutaneous endoscopic gastrostomy, used for feeding purposes, especially when you are taking and giving head and neck radiation. And the last one. But it is a graft, a vascular graft, which is an ioto-bifemoral graft used for iotoiliac occlusion, made up of Dacron. So I think any instrument or anything can be kept for you on the instrument side, which you have studied over the years. Orthopedic instruments are also kept. I've just scanned through few instruments, tubes, specimens, operative surgery and x-rays, but basic idea is to look into your theory which you have learned over the time, and then describe it as the questions arises. It is not to be by-hearted. All you need to be is to familiarize what sort of things can come to you, and I'm sure you all will do well. And I prepared it in a very short time because I could not take a complete class online, so I thought I'll share these videos to you. I'll prepare a edited video before your final exam, final university exam. But please use this video for your initial learning and transfer it to your friends in the other batches also in the 36 batch. Right. So thank you so much, and do well. All of you do well in the coming final.